In health, the National Association of Resident Doctors, NARD, has started a 7-day warning strike across all of its centers nationwide. The resident doctor strike is to clamor for the release of its kidnapped member, Dr Ganiyat Popoola, who has been in captivity for over 8 months. In a statement, NARD President Dr Dele Abdullahi said the strike will begin on Monday, August 26, 2024 at midnight. Abdullahi disclosed that the decision was made during the virtual emergency National Executive Council meeting held on Sunday, August 25, 2024. He warned the warning strike will last for 1 week and will be total as there will be no emergency care. And to talk about this, we're joined by Dr Egbe John Jonah, Publicity and Social Secretary, National Association of Resident Doctors. Good afternoon. Glad to have you join me. Are you there, Doctor? Good afternoon.
Good afternoon. Dr. Egbe is here.
Okay, let me kick off by asking what specific actions or responses is NARD hoping to achieve through this 7 days warning strike? And also, how does the association plan to escalate if their demands are not met?
Thank you very much for your kind question. We decided to embark on this 7-day warning strike as a result of the fact that our colleague who has been in captivity for the past 8 months is still in the kidnappers' den. Sometime in July, we had a meeting, a National Executive Council meeting in Katsina, where a communique was rolled out demanding her immediate release. Following that, we convoked a subsequent emergency meeting where we gave an ultimatum of 2 weeks. Now, upon expiration of the ultimatum, we will have to convoke another meeting which may necessitate a strike. That was what gave birth to this strike, because at the expiration of the said 2 weeks, nothing was done concerning the release of our colleague. All we demand for is the safe release of Dr Ganiyat Popoola, who has been in captivity for the past 8 months. A woman who probably have worn just one clothes for this period under the piercing sun and scorching sun and rain. We demand our release. We urge the federal government to rise up to this methodical challenge that is plaguing the Nigerian Association of Resident Doctors. It is something that is so worrisome. That's why we have to take to this strike. We tend to escalate if nothing is done.
Okay. Now, aside this notice for strike, action, what other efforts has been made by the association to ensure the release of Dr. Ganiyat Popoola? What efforts has been made so far?
The association has been in touch with several agencies. The Dr. Dele Abdullahi led Nigerian Association of Resident Doctors have been everywhere. They've tried to establish contact with the Kaduna State government. They've established contact with the DSS, established contact with Nigeria, the Federal Ministry of Health, and then even the presidency. Those are efforts in place to ensure the safe release of our colleague. We have also been in touch with the family of the Dr. Ganiyat. We've also been in touch with the hospital where she works, National Eye Center, Kaduna. So all hands are on deck towards ensuring our colleague is released.
You talked about you being in touch with the Kaduna State government. You also mentioned the DSS and also the Federal Ministry of Health. What has been their response while you made, while you reached out to them?
From the last meeting we had with the Federal Ministry of Health, the Federal Ministry of Health, if you read the newspaper some days ago, actually petitioned the Inspector General of Police to ensure that they do the needful. So from the part of the Federal Ministry of Health, they responded to our plea by also adding voice to our demand, ensuring the safe release of our colleague. The Kaduna State government had a meeting with the leadership of the Nigerian Association of Resident Doctors upon a time. Although that meeting was inconclusive, they were to reconvene some days ago, but something happened. So subsequently, we hope they are able to put together a meeting to forge a way forward.
Well, indeed, we hope these efforts yield fruition. Thank you so much for your time on the news. Dr. Egbe John Jonah, Publicity and Social Secretary for NARD. Many thanks indeed.
Thank you very much.